well, firstly, I think it's good to recognize sort of those four pillars of sleep.
Yeah.
That, depth, duration, continuity, regularity. But I think there are five actionable things that people could do tonight to start getting better sleep, and we've mentioned many of them. The first is darkness. You really do need some degree of darkness at night to release that hormone melatonin, which helps trigger the timing and the healthy onset of sleep.
And you would say about maybe 4 hours before your bedtime, or what would you say?
Yeah, I
before?
would say 3 to 4
3 to
hours
4.
is the time to start thinking about your light saturation exposure, certainly in the last hour before bed. So an hour before bed, certainly close computers down, try not to stare at phones, and dim half the lights down in the house. It really is powerful. The second is temperature. Try to set your bedroom temperature to somewhere between about 63 to 66 degrees for most people is optimal. Colder than most people think.
Yeah, that is definitely colder than.
Yeah, and if you get cold feet, it's okay to wear socks, but cold it must be. The third thing is what I would suggest is walk it out, which is don't stay in bed awake. This is one of the mistakes that a lot of people make. In this era, I think most people, because of anxiety, were wired and tired. And one of the problems when you are lying in bed awake for a period of time, anything more than 20 minutes is not great. Because what happens is that your brain very quickly starts to learn the association between being in bed is about being awake rather than your bed being the place of sleep. And so it learns this association. And so many of the patients that I'll speak to, they'll say, look, I'm falling asleep on the couch watching television, and then I get into bed and I'm wide awake and I don't know why. And the answer is because you've made the association between your bed is the place of wakefulness, not your place of sleep. So the answer is you need to break that association. Get out of bed, go to another room, in dim light, just read a book, no computers, and only return to bed when you feel very sleepy. And the first night, this may mean that you're awake for 2 or 3 hours. And it sounds bad and it sounds strange coming from someone like me, but that's better than staying in bed awake for those 2 or 3 hours. And over time, gradually, by only returning bed when you're sleepy, your brain will relearn the association that it once had when you were a child, and you can relearn it, which is that your bed is a place of deep sleep and sound sleep. So that's the next thing. I think the final two things we've touched upon a little bit, which is alcohol and caffeine. Caffeine, many people know, keeps them awake. It's a stimulant. It's what we call a psychoactive stimulant. It's the only psychoactive stimulant, by the way, that we readily give to our children in an unregularized, free way, which I think is a problem. Caffeine has several problems with it. Firstly, because of it being a stimulant, it can keep you awake, and it makes it harder for you to fall asleep. A lot of people, though, will say to me, look, I'm one of those people who can have a cup of coffee with dinner and I fall asleep and I stay asleep and I'm just fine. Even if that's true, we and others have done these studies. If you give someone a standard dose of 1 cup of coffee in the evening, 200 milligrams of caffeine, the amount of deep sleep that they have is reduced by 20%. You would normally have to age an individual by 10 or 15 years to drop your deep sleep quality by 20%. Or you can do it simply by having a cup of caffeinated drink or coffee in the evening. So caffeine is a problem. The other problem with caffeine is its duration of action. Caffeine has a half-life of about 6 or 7 hours, and a half-life simply means the amount of time it takes for 50% of the drug to still be in your system or 50% of it to be cleared. Caffeine has a quarter life of about 12 hours. In other words, if you have a cup of coffee at noon, quarter of that caffeine is still circulating in your brain at midnight. So if you have a cup of coffee at noon, it's the equivalent of getting into bed at midnight, and just before you turn out the lights, you swig a quarter of a cup of Starbucks and you hope for a good night of sleep. It's probably not going to happen. So the advice would be try to cut caffeine off around about midday if you can. And even if you're someone who can fall asleep fine, stay asleep, you should just know that caffeine can still impact your sleep. It's what usually creates the vicious cycle, by the way, that those people will wake up the next day, they feel unrefreshed and unrestored by their sleep. They don't remember waking up, so they don't think it's the cup of coffee. but now they start reaching for 2 cups of coffee in the morning rather than one. They've got now more caffeine in the system. The next night they have even less deep sleep. The next morning they wake up even less refreshed, and now they drink more caffeine, self-fulfilling prophecy. Final one is alcohol. Alcohol is probably the most misunderstood sleep aid or sleep drug. It's what most people usually reach for when over-the-counter medications have failed. Alcohol is a sedative. It's a class of drugs that we call as sedatives, and sedation is not sleep. So when you drink alcohol, what you're doing is sedating your cortex. You're just knocking yourself out, and that's why you think that you fall asleep faster. There are 2 other problems with alcohol. Firstly, alcohol will litter your sleep with many more awakenings throughout the night. And in fact, some people can even see this on their sleep trackers, even though they're not necessarily as accurate as as my sleep laboratory would be. Even with that less accurate measure, you can still see the impact of alcohol in sleep. So it litters your sleep with awakenings, fragmenting your sleep. So this comes back to the third of the 4 pillars of good sleep, which is continuity. It takes away your continuous sleep and it makes it fragmented. The final part of alcohol is that it's one of the best chemicals that we know for suppressing REM sleep alongside marijuana. Now, by the way, I should say that's THC specific. If you look at CBD, the evidence seems to be less clear. CBD actually doesn't seem to be as detrimental to your sleep as THC. If anything,
Yeah, because there a lot of people. I mean, again, this is just anecdotal talk about how marijuana improves their sleep.
Yes, yeah. So marijuana, and again, we have to separate sort of the active from the inactive component. THC, tetrahydrocannabinol, is the active component, and CBD is the sort of the non-hallucinogenic component.
But they're both in if people are taking the whole plant.
Typically, exactly. Now, with strains and drops that you can buy, you can separate those out. You can play around with the ratios, and you can get very low THC to very high CBD. THC does tend to decrease the time it takes you to fall asleep, but it tends to make you sometimes wake up more throughout the night, but it certainly does seem to block REM sleep. One of the other problems with THC dosing of sleep is that you become dependent on that for sleep. And when you stop using THC for sleep, you have quite bad rebound insomnia, which leads to then a perpetuating cycle of dependency. And I think, I'm never keen for dependency on anything, be it dependency on, any, food substance or anything. I think you should, be able to generate all of the physiological pathways and processes that you need, naturally without dependency. CBD is interesting, though. There is nowhere near enough data for someone like me to make any recommendations. So all I can do is tell you the very limited data that there is right now. CBD does not seem to produce the degree of REM sleep impairment that we've seen with THC. What's interesting is that low dose CBD actually seems to be wake promoting. So you actually are sort of forcing yourself more awake. High dose CBD seems to help people sleep more consistently. I would have thought it would be the opposite, that low dose would have been better than high dose, but the opposite seems to be true. Now, we don't know about the dependency, we don't know about the long-term effects, so I am not going to sit here and give any recommendations regarding THC use or CBD use. We know that sleeping pills are associated with a markedly higher risk of death, as well as cancer, as well as your susceptibility to infection, particularly pneumonia. But returning to alcohol, it is definitely one of the most, I think, misunderstood drugs. But what I was saying regarding THC, alcohol, sleeping pills, if you are using anything to help you sleep, I think you have to ask yourself, are you just really treating, an open wound and not really actually trying to stitch it up? Because what that is simply doing is masking a problem that you're not dealing with. Why is it that, and this is not a criticism, and I'm sorry if my voice sounds like that, and it's not, I'm so sympathetic to people who have sleep problems. We see them all of the time here. But you have to ask why. Why is it that you're struggling with sleep? Is it because you're of a certain chronotype and you don't understand your chronotype and you're sleeping at the wrong phase of the 24-hour period and masquerading as insomnia? Or do you have too much anxiety in your life and you're blunting that anxiety with things like alcohol or THC or sleeping pills? You know, you're just kicking the can down the road. You're just hitting the mute button, but the movie is still playing of damage. Whatever is causing that sleep disruption, you know, is still there. You're just sedating your brain and trying to mask it.